Thanks, Kimberly. And it was fabulous to have a listen to Jackie. There's lots of synergies in our work. I suspect as a panel, it's more interesting sometimes to have panelists who disagree, but that's definitely not the case today. And in fact, the reason I can't be there with you in person is because I've been hosting a colleague from Chile here today, and she has just presented on what's happening in the school system and the significant decline in school attendance since the pandemic and school closures in Chile and in Latin America more broadly. So picking up on what Jackie was presenting there earlier. Uh, so yes, next slide, please. I'm presenting from the lands of the Wurundjeri people of the Kulin Nation here on the main campus of the University of Melbourne. And if we go to the next slide, just to give you a sense of what I'm going to briefly cover is the increased risk of exposure to disasters as a result of climate change and the implications of that for post-disaster wellbeing and recovery, and the importance of tailoring any approach we make to the groups involved, the context, the circumstances of the disaster, and so on. We'll talk more about that as we go, and also the work that we've been doing to develop resources and training that will support those who are in the field, who are making policy decisions, and who are community-based to work productively to restore wellbeing. Thank you. So if we go to the next slide, as we all know, and I'm sure you've been talking about it a lot at the conference, the impact of climate change is being felt in many different ways, including increased frequency of disasters, severity of disasters, and the experience of overlapping disasters or multiple disaster exposures over a period of time. And one of the things that we're aware of, there's very strong evidence internationally, if we go to the next slide, are the long-term mental health implications of experiencing a disaster. And obviously that doesn't mean that if you're in a disaster, you are automatically traumatized, but we do see elevated risk and we see that as a sustained risk. And so if we go to the next slide, you'll see that that's based on evidence which we've reviewed from around the world. So it's very consistent, and certainly the levels of symptoms of a serious mental health disorder vary, but we see them occurring in the wake of pretty much every disaster. And it would not be unreasonable to expect that the rates of mental health issues in a community or a broader society that's affected would at least double for a significant period of time. Thank you. If we go to the next slide, you'll see that we've had a look at, well, what does that mean if we're now talking about people being exposed to multiple disasters? And what we found was that further increases the risk of poor physical and mental health. And in some ways, this is obvious. If you experience hardship, of course, it's going to affect mental health and well-being. But I think it's a really important area to build evidence, because it is a very common phrase in our society and others that what doesn't kill you makes you stronger. And so it can be a glib remark, or it can be used to inform decisions that if people have survived an event like that, then they're in a stronger position in the face of a future disaster event. And what we know is that while knowledge and experience can build your skills and understanding of what's involved, if you have been significantly impacted and you haven't yet recovered, remembering there's a very long tail of recovery to these events, then you're actually more fragile when the next event comes along. So we have a society where we have increased risk of disasters and increased risk of multiple exposures. So whenever we're talking about mental health and wellbeing for Australians, this needs to be part of the conversation. If we go to the next slide, we do have some underlying principles for how to support people to cope with these experiences. And they really come back to quite simple steps that I find reassuring, because we all can do this. We can all promote a sense of safety and try to restore calm and build that notion of self-efficacy, so I can manage this situation, and the sense of community efficacy. We can get through this, as well as ensuring that people are connected and have social supports and a sense of hope for the future. So these are really strong principles that underlie psychological first aid and are supported by evidence. What we can see, though, when we look at these up here on the screen, is that we are now facing the realities of climate change. So how is that affecting people's sense of safety and sense of calm, their sense of efficacy, and their sense of hope? So these core mechanisms for managing the emotional impacts of these events are absolutely undermined by the new realities that we're facing. So this is a real challenge of our time. And if we go to the next step, it's not just those emotional aspects of the experience that affect well-being, but also the practical impacts. So the evidence is really clear that the post-disaster distresses that inevitably happen after these events really can undermine resilience in many different ways. I mean, this image is an obvious one. A road closure can add an hour to someone's home to school commute, for example. And that's a fairly minor irritation, but of course it's amplified by all the other irritations that happen in the weeks and months and years after a disaster. And more fundamentally, it's the loss of people's homes, their source of income, and breakdowns in relationship that we found in our research, shown here, that is very clearly associated with poorer mental health outcomes 3, 5, and 10 years after the event. So if we go to the next slide, what we've been really focusing on in our research, and this aligns very much with what Jackie was showing, was that there are different domains that impact our capacity to recover and our well-being. These are resources that we can draw on, or what we're referring to here as disaster recovery capitals. So human capital refers to knowledge, health, skills that we need to bring into play. Political refers to your capacity to influence decisions that are made and to access resources. Social, of course, are our social networks and the supports that we draw on. Cultural is that sense of belonging, the creative expression, and the cultural connections that we have to each other and to country. The natural environment is that really fundamental connection we do have to the natural environment and how it affects our well-being, but also more practical elements of local economy, tourism, and so on. Financial resources are self-evident, and of course built refers to properties, but also roads, bridges, infrastructure. So there's an interconnection between all of these, and the image on the next slide is just an indicator of the work that we're doing with our Aboriginal colleagues and our Indigenous colleagues in Aotearoa, New Zealand, to understand the fluidity of these various resources that influence our well-being in relation to disasters that we can think about before disasters occur as well as after. And of course, when we're in that context of multiple disaster exposure, the reality is so many of our communities are still recovering from a previous disaster while they're preparing for and responding to other events. So we have previously developed the guide to disaster recovery capitals, which you can see on the next slide and is available electronically. And this was really intended originally for disaster recovery practitioners, but we've designed it to be super accessible and practical. So we're finding it's been used by people in all sorts of different roles in thinking about what might need to be in place in the region or the context that people are working in. So if we go to the next slide, you'll see that within this resource, we've really just tried to say, if we're thinking about, in this instance, social capital, here are some things that we know from the evidence. So there'll be a number of pages. What do we know about social capital? And on the basis of that, what should be considered when you're doing your own planning and discussing disaster recovery and resilience? And the little symbols at the bottom show how that might be interconnected with other forms of other forms of capital. And of course, a fundamental element of this is who gets to be part of those discussions and who gets to be part of that decision making. And although the core principles are that there should be community-led recovery, that is still very complex. And so as you can see on the next slide, our team have been working with communities and with practitioners to develop tools to aid that process of understanding for this particular community, what role might their locals have in guiding decision making, and what have they got covered and what don't they have covered? Where might support be most useful? And if we go to the next slide, you can see that we're also developing tools around social network mapping. So who's connected to who in a community and who might be excluded at the moment from decision making. So how do you address that in the processes that are taking place? So finally, when we go to the next slide, you'll see that we have established a short course, Foundations in Disaster Recovery. And that's designed for anyone who's really working in the space. It was originally designed for practitioners and volunteers and community members. We're finding that all sorts of people come at very different levels of seniority, and working off each other has been really helpful. So there's an online component to the course and an optional in-person workshop. And that's been going very well. NEMA have allocated that as compulsory training for their operational staff. We have scholarships available for people who might not be in a position to cover the costs of the short course fees. And we've got some upcoming rounds coming up in July and October. So I just think it's really important to not only to point at some of the issues, some of the problems, some of the work that's being done, but how can people enter into this space and build some capacity to address these issues. So if we go to the final slide, my takeaways for the discussion are that climate change and multi-disaster exposure will be major influences. They are already major influences on wellbeing and will become increasingly so. That sadly, although we're often asked, there are no checklists for which strategies would you put in place in a given community, but rather there are really well-established approaches that can be tailored to local contexts. And the encouraging thing is that these things can be developed in advance of disasters or in between crises because they have benefits for everyday life. It's not just about putting things in place in case there is a crisis coming up. And even though the space is changing with the multi-disaster exposure, there are still useful resources and training that is available, and Jackie's fabulous looking dashboard that can be made available for people who are working in this space. And I'll leave it there. Thank you.